Good afternoon, everyone. I'm Ryan Delarami, and I'm pleased to be here, and thank you for inviting me. I'm from Toronto, city of Concord, and which is part of the treaty and land of Mississaugas of the Credit. And what I'm going to talk to you about is enhancing access to quality care, and the term being quality, using telepresence and virtual world. And this is enhanced with AI and AR. Now, what is telepresence? We've heard telemedicine, telehealth, and it's pretty much video conferencing, things like Teams, Zooms, and the likes of it. What telepresence brings, which is what we're trying to do, is replicate the in-presence experience, as if you're in the room with the person delivering care, which brings on hands-on care. So it's not just talking to your doctor, refilling your prescription. It's much more than that, doing surgery, doing wound care, doing EMS services, things like that. So with that context, I'm going to start with a couple of slides. First of all, I'd like to acknowledge that, if this goes forward, that we're committed as a digital health company to provide technology that brings equity and access to care. And again, quality care, not just care. And as such, we've developed the technology. We're also here to collaborate and learn from the Indigenous communities to their challenges and how we can improve on that, and how we can provide a meaningful technology that is culturally sensitive and in line with the traditions and the needs and their values. Our guiding principles. We are guided by the aims of healthcare. So what we do is we look at this and we say, how do we improve outcomes? How do we bring health equity? How do we improve patient and providers' experience? How do we save costs? How do we bring efficiencies to the healthcare practice? So that's how we sort of look at developing our technology with these guidelines in mind. The why is obvious. Why do we have to do this? So if you think of the complex medical cares that people receive, you need an expert. In Canada, 97% of specialists reside in 15 communities or 15 municipalities, and only 3% serve the rest. So there's a disparity between where you can get expert advice. And it's not just Canada, everywhere in the world, it's the same thing. So to deliver those in rural communities and remote areas, basically you don't have the expertise. You might have people that are delivering some level of care, but not to the level that you want. So as a result of that, what happens is patients have to leave their communities and go receive care somewhere else. What does that bring? You go with unfamiliar care providers, the people and the faces that you don't know, and there's implications of that. Work restrictions. You have to take time of work. You have to make arrangements for the family when you're gone. There's emotional implications, and also cost of travel, which we're all too familiar with that. So how do we sort of address this as a technology company? Our solution is a cloud-based solution. And the way we've designed it is with the patients and the community in mind. So this is not about the clinicians, this is not about the physicians, this is about the patients. How do we deliver the best care possible to patients? Obviously, you'll need community care. So when you're sort of looking for services, there are many things that can be done in your own community, and you don't have to leave the community, which is going to be great, and we'll talk about that. Sometimes you have to go to a hospital for specialty care. And those hospitals do not have the mechanism to communicate with each other. Even today, we look at physicians and care providers. They use their personal phone, they FaceTime each other, they WhatsApp each other, and they send photos on their personal phone. We violate every privacy rule that we're scrutinized about by doing so. So how do we make this meaningful for the clinicians to have a platform to communicate with each other? First responders, they play a critical role in patient care, in the patient journey, because as they're transferring the patient, you can deliver life-saving treatment. And often that's not possible because what they're trying to do is communicate through phone. I just came back from a conference, EMS conference last week, and talking to most of these chiefs, that's how they explain the situation. The paramedic is on a phone telling the other person on the other call what they see, and it's hard to convey that message. a whole bunch of sort of peer-to-peer consultations. You get second opinions. When your specialist talks to another specialist, have you seen this case before? Things like that. And again, these have to be meaningful conversations beyond a phone call. With the advent of technology, there's a lot of remote imaging going on. Simple things like early birth defects can be detected with a simple ultrasound. But the technology is now there. Who could do it? That's a different story. You need some expertise, and this technology can be provided. A lot of services are delivered at home. Patients receive all sorts of different care at home, and that's critical as well. And most importantly, what happens when the patient leaves the care environment, when they go home? How do we monitor them? How do we track them? How do we keep in touch with them? We can't have people sitting on a phone talking to patients on the phone and asking them, and that's not possible. You need a full-time person to talk to 25, 30 patients a day, and that's not feasible, especially in today's world where everybody has low resources. So this, as a whole, is how we approach the delivery of care. It's a system-wide solution, not a point solution. Everybody is tired of having 10 different things to log in and 12 different things to learn. This is the approach that we take. Now, how do we do it in sort of practical terms? Obviously, we have to provide the tools that the clinicians need. What's the first thing you need to do when you have virtual care? You need to see what the clinician is seeing. And for that, we have a whole suite of devices. We're not a device manufacturer, we're a software company. We use off-the-shelf devices that are easy to replace, easy to upgrade, and low cost. So it doesn't have to be very expensive. We don't sell you a $100,000 robot or a $50,000 telemedicine cart that comes with bells and whistles, and as soon as one piece breaks, you have to throw it out. It's all modular, it's all replaceable. Then we build around that clinical workflows. So if you think of I'll give you an example. If you're in a surgical room, your needs are quite different from somebody in back of the ambulance or somebody sitting behind a microscope as a pathologist. We have clinical workflows for each of these different specialties, so it makes their life easier. Clinical collaboration tools. What is this platform if you can't collaborate with each other? You have to have meaningful collaboration tools built into the platform, so you don't have to use your phone. You don't have to get on WhatsApp. You don't have to use FaceTime, all that good stuff. Making tools available for triaging patients, notifying the physician most responsible. So you don't want to pick up the call, you want to press a button and page them. And this is all possible through this platform. But if you're dealing with patients, having a visual feed is not enough. You need to look at medical devices, perhaps patient monitors, ventilators, anesthesiology machines, you name it, all these different tools that clinicians use in their environment. So how do we manage those? We bring those feed in directly to the call, and I'll show you in a second. Same thing with medical imaging devices. A lot of our procedures involve endoscopy, fluoroscopy, x-rays, all sorts of different procedures, ultrasound, and we bring all that into the call. So again, make it as immersive as possible. EMR integration, on top of everybody's mind, and the first conversation you usually have is, do you integrate with EMR? To that extent, we went and redesigned our back end to be FHIR compatible, meaning that if you want our data, you can pull it however you like into your system with ease. And this is all done with our partners, Smile Digital Health, and they have a server called Happy FHIR, and we've used that to build that backend for our platform. And then we heard about mobile clinics. So we've put together a number of devices to act as a digital front door. And we'll talk about some of the Indigenous communities in Northwest Ontario who are using this technology, and this is acting as their digital front door. So we've basically given you the tools that you need to have a full-blown clinic. You can remotely examine the patient, listen to the patient's heart, look into the patient's ear, check their skin, look at their sort of vital signs. All that thing is built into this tiny little machine, and best of all, it costs you next to none. And then when the patient goes home, similarly, a suite of devices that they can use for different sort of purposes. And some cases, you don't even need a device. You can just use the application for that. A lot of times patient-reported outcomes are the most valuable piece of information. So you want to know how the patient feels. That is provided. Or using different devices and different sort of tools to do that. And on top of all this sits our AI engine, which does a whole bunch of sort of analytics and machine learning and large language models, which is outside this sort of scope of this talk, but those are all sort of interrelated. So you can see how TeleVu as a cloud solution sits in the middle to interconnect all these pieces in an interoperable manner, so which is basically very efficient and very useful. And I'll give you some examples of that. And best of all, we meet all the security and privacy requirements that are globally required. Now, in this example, I'm going to show you how Northwest Ontario's regional wound care program uses TeleVu. So if you look at virtual health or virtual care, like I said, initially people think about virtual care as a video call, which is not, and I'll show you why. We have the frontline user, basically the person, the clinician with the patient. We have obviously the patient and the remote expert. So what do we give to the frontline user? We allow the frontline user to have access to a number of different tools. It could be handheld devices. It could be wearable devices, such as smart glasses. It could be medical devices and monitors and imaging devices. It could be all sorts of cameras, and again, hardware agnostic, and then digital workflows. So these are the tools available to the frontline user. And then the remote expert can sort of dial in, if you will, into the platform and look at all these feeds collectively or individually, depending on the use case. So now they have the full picture of what's going on, not just the narration of it. And then the patients, as required, they can provide their input, either through the devices they have and sensors that they have, or simply through messaging. And this kind of completes the picture. Now, they've built a digital sort of a model, which is a hub and spoke model. At the center sits their regional wound care program, which in this case is Thunder Bay Regional Hospital and St. Joseph Care Group. And they obviously have all the experts they need. They have vascular surgeons, they have plastic surgeons, they have NSWAC nurses, and all the other specialties required to manage that wound care program. By the way, Northwest Ontario is one of the highest, has the highest rate of amputation globally, not just in Ontario. Diabetic ulcers are pretty complex to deal with, and usually when they were dealt with, they had to be transferred to the hospital, which is the regional hospital, and we'll get to that in a second. Now with this, they have the nurse or a physician or a nurse practitioner, whoever's in the community has access to TeleVu technology or the TeleVu tools, and they can now connect to that expert in real time. Initially, during the first phase of the sort of project, it was on demand. So whenever they needed an expert, they were available. Somebody was on call, somebody's available. Now it's all scheduled. Now, as a result, you could discharge the patient, which often that's the case. So the patient does not have to leave the community to receive care. They receive advanced care in their community. Sometimes you need to just monitor them for a little while. You put them on a virtual ward at-home monitoring program. We specifically designed one for wound care. Or they might need to go back to the hospital, which is in some cases required. They might need surgery, they might need other sort of interventions that can only be delivered in a hospital. And you can now replicate this to many different communities. Initially there was 4 communities, now there's 12, and the plan is to go to 50 communities in Ontario and cover all communities by this model. Now, we started with wound care, but it doesn't end there, and we'll talk about that as well. Now, a key piece of hardware that we use, and I just want to highlight that, is the smart glasses. And this is the wearable piece that we use. So if you look at the smart glasses, basically you wear them like glasses, as the name suggests. It has a camera in the front, which is pointing to where the eyes are looking at. So that's a point of vision feed that is critical in this kind of hands-on procedures. It has a display inside it that when you look at it as a heads-up display, seems like a 7-inch tablet. It's like you have a tablet in your hand, you have a camera on the other hand, and then it's got built-in audio. So speaker and a noise canceling microphone. So that's the only device you need to communicate. You don't need a phone. So even if you had somebody else to hold the phone for you, that becomes a 2-man job, which is not really feasible these days. And as the clinician wears that, this is how it looks like. It has various different types of mounts, and you could look at what the patient is doing or what the procedures what procedure is being performed. And this is kind of what it looks like on the heads-up display. You can see the different images, and on top of that, using our software, you could provide augmented reality interactions, which we'll get to that in a second. So essentially, somebody puts the glasses on the other side of the line, whoever that is, wherever they are, doesn't matter if they're in Toronto or if they're on the other side of the globe, they can see what that person is looking at and provide interactive guidance. So you don't have to say a little bit to the left, a little bit to the right. You literally show them, put the catheter over here, cut over here, superimpose the image of the dressing so they can replicate what you're doing. So all these different tools that we've built for this purpose. Now, I'll give you a little taste of what it looks like from a clinician's perspective. One, the glasses. When you put it on, like I said, you get a point of vision feed. This is an ultrasound sort of being performed. This is great for hands-on procedures. This is being used in surgical procedures, interventional procedures, for wound care, again, for intubation of the patient in the ER. Doesn't matter. If you're hands-on in a procedure, that's the right tool for you. But that's not enough, because if you look at the patient, let's say in wound care, you want to see the other leg. A lot of technologies exist that take photos of the wound and analyzes it using AI, but that's not sufficient. What about the color of the other leg? What about the swelling of the other leg? You're missing all those pieces of information, yet you're making a diagnostic decision. That's not enough. So how do we show that? We give you CamView, which is a camera installed anywhere you want. It's flexible. It has a mount. You can put it wherever you want. And best of all, you control it from within TeleVU. You can rotate it. You can zoom in. You can pan. You can tilt. You can do all sorts of things with it. So now you got a secondary feed. In the case of ultrasound, which this image is showing, position of the patient is important. So if you're doing an echocardiography, if the patient is not tilted enough, you're not going to get a good image. So the person guiding you cannot know that unless they see the patient. So this is kind of the other part. Now, you're looking at this technology, is looking at the camera, at the screen in front of them, the ultrasound. Sometimes you have to describe that, which is not enough. What do? We bring that feed in to the remote expert directly in high definition. It's not through the eyes of the glasses or through another camera. It's direct feed from the ultrasound device. And not only that, the remote expert can interact with that screen. They can draw on that screen, and the person in front of the patient can see that. They can point to that and say, hey, move the probe over here, or put the catheter over here, whatever the case may be. So it makes it that much more interactive. And best of all, within the call, you have the digital workflows. Sometimes people just need reminders of the steps they need to take, whether it's wound care, whether it's implantable cardiac monitors. All these things have different steps that you have to take, and these tools are provided. So as you can see, it's much more than just having a video call, which is insufficient and leads to lots of errors. I'll give you a few examples. So this is an ER setting. So the patient is being intubated. So from the point of view of the smart glasses, you can see the quality of the glass. It's really excellent. The tip of that catheter has a camera. It's called the glidoscope. You can see it on the top left. And then you can see the view from the room as where the nurse is, where the crash cart is, where everybody is. So imagine now you're an intensivist in a remote area. You can now see what's going on in the environment. Now you can guide the person really in a meaningful way, not just saying, okay, tell me what where's the nurse or where's the crash cart? You have all that information to you. In the back of an ambulance, similarly, you can see the paramedic wearing the glasses, so you know exactly what they're doing with their hands. You can see the vital sign machine inside the ambulance. You can see that they're doing the ultrasound. You can see the feed, and you can also see what's going on in the cabin as they're transferring the patient. Or you can have one inside the driver's seat for accidents or looking at the road conditions and things like that. We don't limit what you could do with it. It's really pretty flexible. In the OR setting, exactly the same concept. The surgeon's view, the patient's bed, and the instrument table, which is very important, the vital sign devices, the x-ray, and again, this is all interactive. You can point to any of these screens, draw on it, superimpose images, have object recognition tools and things like that. And then in an outpatient clinic, this is a wound care clinic, we can bring in advanced tools such as thermal imaging or blue excitation light for visualization of bacterial burden. So all these different tools that have been integrated with this technology. So again, not just a video call. Now, sometimes you don't need to get on a call with your colleague or with your mentor or with your teammate. You could just simply send them information. As I alluded to earlier, like people are using their personal phone, texting each other with medical records or patient x-rays with all that information. Why not do it in a secure fashion? Why not do it where you can actually retrieve the data? All this information that we feed to our platforms, personal devices, they're not retrievable. If you go on WhatsApp, how can you retrieve that information? Whereas if you sit in a platform that is secure, this is AI ready, it's centralized, everybody has access to it. From a compliance perspective, you have track record of the communication, who talked to who gave the order, all that good stuff, which vanishes in thin air when you're not using a platform like this. So essentially, if you look at a TeleVu from a technology perspective, we got the TelePresence platform, which we shared with you. We got the virtual ward platform, which I didn't talk a whole lot about, but this is considered a series of devices that the patients take home, and this completes the circle. Whether you're in a clinical setting or in a home setting, you have access to ultimate care using these tools and using the data that you have to analyze it later and provide more insights. Now let's look at some of the results. So the regional wound care program that I mentioned, Northwest Ontario, they started using TeleVu and they had expectations. So one of the things they were looking at, and they had metrics and they looked at it, one was wound size reduction. So obviously that's a metric of wound improvement. They were hoping to achieve 30%. With TeleVu, they got 56% on average. In fact, 75% of all wounds were reduced in size across all patients. One of the other things they were looking at is compliance and adherence to dressing choices, so formulary choices. And this has cost implications as well. They were hoping to get 75%. And by the way, 75% is the standard average. So if you're in a Toronto hospital with the highest standard, you're hoping to get 75%. They achieved 86%. Next one, which is to me the most important one, reducing wait time to receive treatment. Typically in that region, if the patient had a complex wound, it took them 11 days to go through the intake process and see a specialist in Thunder Bay. Now, imagine if you're a patient with a diabetic ulcer and you're just developing an infection and you have to wait 11 days. By the time you get to the hospital, they have to cut your leg off, and simple as that. You lose your limb. So that 10 extra days means something. This was dropped down to 1.67 days using TeleVu. Basically same day. The only reason it's a little bit more than a day is because of specialist availability. One of the things I want to kind of side and plug in is that virtual care is important when you have dedicated staff. Now, we can't expect hospitals to bring in digital technology into the physical world and expect to work the same. Physicians and nurses are all busy doing their daily job, so you can't have them on standby to attend sort of virtual care. So that was the important piece there. This is also very significant. Travel time for patients. Patients saved on average almost 1,300 kilometers per quarter. That's almost 5,000 kilometers a year of travel paid by Northern Travel Grants. So this is direct cost saving through this sort of technology. And let's put this cost aside. Imagine the patient's convenience, not having to travel, because you saw all the issues with traveling. You have to arrange time off work, arrange for family sort of affairs and whatnot. And then, this was a great one for me as well. They saved a limb. This was a patient that otherwise, if they hadn't referred the patient in a timely manner, it would have resulted in an amputation. And they were able to achieve that with this technology because it's instantaneous sort of consultation. And they were looking for a positive ROI, and guess what? They got one. So by all means, this was a very successful sort of proof of success. I don't like to call it proof of concept because we've proven that over and over again. We're in 14 African countries using it for surgical training programs. 6 Asian countries similarly. We have it for telepathology, all sorts of different tools. And as a result of this pilot, inside those communities, other use cases came about. There was a patient with chemical burn who was treated in the community without having to leave the community. Again, a significant sort of improvement over what they were currently doing. Telepathology, Lake of the Woods is now connected to Toronto General Hospital through the same technology. So you don't need to buy another sort of tool, it's all built into the same platform. And when they're doing their grossing, they're doing it with live pathology assistant on the call. And then lastly, community paramedicine. In Kenora, they're using this technology so when they go to patient's home, the paramedic can connect to the regional program. So benefits realized. Let's look at some of the benefits that was realized as part of using TeleVu. Improve outcomes. You saw the wound care reduction, not having to amputate the patient. Access to timely, again, I emphasized quality care. Access to care is one thing, access to quality care is another. Reducing costs, reducing travel both for the patient and the provider. Because guess what? Before this technology, the providers had to go to those communities. So if they had an advanced sort of wound care patient and the patient couldn't be transferred, they had to send a physician or a nurse to the community. Increased compliance, as you saw. Increased providers' confidence. Providers are actually much more confident doing, and they were learning on the job. So once you do a couple of these advanced sort of procedures, the next time you might not need as much help, and you could do it independently. So that builds also capacity in that sense. Clinicians' workload and access to relevant data. Again, going back to data, if you don't have the right point of access for the data, what's the use of it? You can have all the data in the world. If you can't access it, then it's no good to you. And you can see everything that I showed you here, it goes back to what we focused on to build this technology. We focused on all these things, and we delivered on it. And we're hoping to sort of bring this more and more to the front line for the users and for the clinicians. With that, I thank you for your attention, and if there are any questions, I'm happy to answer.
Hardware that's required?
No, it's only the software. So we're a software company, as I mentioned. The hardware, we keep it agnostic. We could use any off-the-shelf hardware, and that's the beauty of it. So again, as I said, it keeps the cost low, and it keeps it easy to replace and access, really.
So the glasses that you demonstrated are not your product?
No.
Okay.
And you could have smart, and there are multiple companies making smart glasses,
okay.
And you could use any of those as long as we test and approve it, obviously, but there are limitations on some of the hardware on the market, which doesn't make it a good fit for healthcare.
Okay.
A lot of these devices are designed for industrial use, so we kind of pick and choose the ones that are right fit for the use cases in healthcare.
Okay, thank you.
Yes, we have it in French, Chinese, Arabic, Spanish, and Portuguese. But the way we've designed the platform, again, back to simplicity and scalability, if you want it in any other language, we'll send you a simple file. You translate that file, send it back to us, and guess what? The language is added to the platform. So it's not a very complex procedure for us. We made it very simple.
So, okay. Follow-up question. This might sound weird, but I'm currently in a working group with the Canadian Space Agency on health in space. Mm-hmm. Is that something that could be applicable there?
Yeah, that's a great question. We've actually worked with UCSF, and one of our devices might actually go to a space station. The problem with that is the communication when you're actually outer space, it takes about 20 minutes for that message to get back to you. But what they're using it for is they're doing some sort of lab testing there. So the person doing it, they used to have a camera up top when, as the person was doing it, their head would block it and all that good stuff. So the videos that came back after 20 minutes or so was not useful. So with this, at least it's point of vision feed, and the software allows them to manipulate it a little bit sort of easier than any other platform. Thank you. My pleasure.